Clostridium tetani, a gram-positive bacterium, by Sierra Berger. Key points. Clostridium tetani is a bacillus, gram-positive, obligate anaerobe. Their colony morphology are usually no bigger than 1 millimeter. They are slightly raised and have a glossy sheen. Other information. They are spore-forming bacilli that are gram-positive. They can be found in the intestinal flora of many organisms including humans and domestic animals. They have stable spores which can withstand as little as 15 minutes of boiling to 15 psi in an autoclave for 15 minutes. Their culture best resides on an oxygen-rich blood agar in anaerobic conditions. It will not ferment arabinose, mannose, xylose, lactose, maltose, and fructose. Disease and infections. Tetanus, also known as lockjaw, is an infection caused by Clostridium tetani. The effects of the infection. This causes tightening of the jaw muscles, stomach muscle tightening, stiffness all over body, seizures, sweating and fever, trouble swallowing and breathing, as well as a raise or fall of blood pressure, and lastly, it can also cause headaches. The main hosts and reservoirs for this bacterium are humans and animals. Tetanus bacilli spores are usually found in soil, animal intestines, feces, and even dust. Animals are more likely to carry this bacteria within their intestines because they are more likely to come in contact with soil. Humans come in contact with this bacterium usually via injury caused by an object or animal that contains these tetanus bacillus spores. Transmission. Because this bacterium likes environments like soil, animal intestines, feces, and dust, it is likely that humans and animals will come in contact with it. Since animals are more likely to come in contact with soil, they transmit via soil. Humans come in contact with this bacterium usually via an injury. Steps of transmission in the body. The toxin first attaches to the gangliosides on the peripheral nervous system. It then moves to the central nervous system. This causes alpha motor neurons to have no control, causing spasms. This effect is then placed on the spinal cord, peripheral nerves, the brainstem, directly on muscles, and even the neuromuscular junctions. Once the autonomic nervous system is affected, it can also cause severe sweating, cardiac arrhythmias, and easily altered blood pressure. Treatment and prevention. These steps of treatments are depending on the severity of the situation. First, go to the hospital and seek medical attention. Get treated with a TIG drug therapy, also known as tetanus immunoglobulin therapy. Treat the wound and receive antibiotics, a vaccine, and a booster as well. To prevent this infection, you must keep up with your tetanus vaccine and booster when needed. Treat the wound as soon as possible, and lastly, wash your hands to prevent further infection. Questions. These are the most commonly asked questions about C. tetani and their answers. How long does it take to show signs of tetanus after being exposed? Clostridium tetani's incubation period can be between 3 and 21 days, and there is an average of 8 days. Depending on the distance of the injury from the central nervous system, the longer it will take to show signs of infection. How is tetanus diagnosed? It is diagnosed only via clinical signs and symptoms because there are no laboratory diagnostics for this infection. What kind of injuries might allow tetanus to enter the body? Any injury that is contaminated by dirt, animal feces, and manure cause this infection. How serious is tetanus? Tetanus has a high mortality rate where its cases have about 10 to 20% of them become fatal. These are my references I used in my presentation. Thank you.